we all are aware of the fact that during the time of the year when there's a lot of pollution, people very often will have prolonged coughs. They'll have colds that last for a really long time. There are upper respiratory symptoms that children experience a lot when they're playing outdoors. So it clearly affects the respiratory system. That's the most obvious thing that we are all aware of. What we are sometimes not aware of is the fact that pregnant women, for example, it can affect their unborn children even before they are born. It can be there are studies which have shown an association between the weight of a newborn baby and air pollution. So more the air pollution, more likely is it for the newborn baby to have a lower weight. It can affect growth and development. We know that lung function in the long run is also strongly associated with exposure to air pollution. So people who grow in countries where the air pollution tends to be high very often will not achieve the same height as people who grow in countries where air pollution is low. They may not achieve the same level of lung function as the other countries. So if you look at the breakdown of pollution in Mumbai, based on the MPCB report that was published, I think, in 2003, when you look at larger particles, when you look at PM10, the construction and demolition dust contributes significantly to the larger particles. When you look at smaller particles like PM2.5, the construction dust contributes about 10 to 15% is what I understand. Whereas their vehicular emissions, a lot of other factors come into play, which contribute to the PM2.5. So to answer your question, yeah, when you're looking at larger particles, which is very often what we see, what is visible, I think construction dust plays a significant role. So in patients who have chronic lung diseases such as chronic obstructive pulmonary disease or COPD that we are familiarized with, or asthma or lung fibrosis, a change in air quality can cause a severe worsening of their symptoms. We use a term called exacerbation, that's the medical term, but basically they suffer from lung attacks where their wheezing increases significantly, they get more breathless. They very often need either short courses of steroids, extra inhalers, antibiotics, nebulizers to settle their symptoms. So these are the people who are most sensitive to a change in air quality level. And very often we see people with chronic respiratory diseases have attacks or have worsening during this period of time. So if you ask pulmonologists from across the city, they will all tell you that somewhere between October to about February tends to be the worst time for people with chronic respiratory diseases. Or the second leading cause of death in India is a disease called chronic obstructive pulmonary disease or COPD. Now, the Western world has always described this disease to be associated with smoking. But a lot of our Indian data tells us that a significant proportion of people who don't smoke tend to get this disease as well in India. Now, we know that biomass fuels, for example, cooking indoors on a chula or a sigdi is strongly associated with it. What has not been studied enough is the association of air pollution leading to the same kind of disease. So we have a lot of people in the city of Mumbai, for example, who've never cooked on a chula or who've never smoked cigarettes, who still end up developing a disease like COPD. And it is it's not unthinkable that this could be purely air pollution causing them to develop the disease. So yes, I think that it definitely can lead to chronic lung diseases by itself. When you talk about short-term health risks is what we are seeing for the past 2 or 3 years in the winters. You're exposed to high doses of pollution. You have these prolonged coughs. You wheeze. You get breathless. When you go outdoors, it becomes difficult to take a walk without feeling a sense of tightness in your chest. These are the short-term effects that are very visible to all of us and what we all complain about. The long-term effects that have been associated with air pollution include the development of high blood pressure, cardiovascular or heart disease, strokes or getting paralyzed because of high blood pressure, and also diseases like diabetes have been associated with air pollution. This is very often because the fine particulate matter, the PM2.5 for example, reaches the part of the lungs that are in intimate or close contact with the blood vessels. So those particles spill over into the circulation, leading to an increased heart rate, leading to an increased blood pressure, increased irritability, all of which can lead to chronic diseases which are not necessarily associated with the lung. I think as Indians, we already know that cardiovascular disease, for example, occurs about a decade earlier in India as compared to the rest of the world. We know that the rates of obesity, the rates of diabetes, lifestyle diseases are clearly rising, right? And we know that these diseases are associated with pollution. So I think the early warning signs, if you've already developed high blood pressure, if there are signs that suggest that everything is not in equilibrium, you should look around and wonder whether it's the air pollution of your city that is contributing to you developing these chronic diseases. Diabetes could also be related to air pollution, again through the same mechanisms, because there is a spillover of fine particulate matter into the lungs, from the lungs into the bloodstream, and that environment of inflammation can very often predispose you to developing diabetes. Definitely help, especially if you're using a high efficiency mask. So a mask like an N95 would definitely filter out a significant proportion of the particulate matter in the air. However, it's not very easy to breathe with a mask, number one. Right? It's not easy to walk fast, it's not easy to run when you're trying to breathe through a mask. The second problem with masks is that they cannot be used for prolonged periods. The clogs or the pores in the mask very often will get clogged, and if they do get clogged, then breathing gets all the more difficult. The efficiency of the mask reduces. So yes, masks do help, but I don't think they can be considered a long-term solution given how difficult it is to breathe with masks. Air purifiers, again, work really well to improve the air quality in an enclosed space. The problem, again, is that number one, you would have to shut down all your windows. In a city like Mumbai, that would mean you would need an air conditioner. It would also generally work on a limited space. So in your bedroom, you can put an air purifier. But what about the rest of the 12, 14, 16 hours that you spend outside your bedroom? Who's going to protect you then? So I don't think it's a feasible solution to think about using air purifiers for an entire home or an entire workplace. Again, it's a solution that is useful, but I don't think it's sustainable in the long term. I think you're trying to put out a forest fire with a glass of water, to give you an analogy, right? So I think when you're talking about an entire airspace which is contaminated to such an extent, I think smog towers are not going to be of much use at all, honestly. When it comes to data, we know for a fact that there is something called an information overload. So when you're told about the AQI on a daily basis, and on a daily basis it tends to be quite poor, there is a sense of helplessness that you have, which eventually leads you to being numb. So you realize that you're being told about the AQI every day, it's not getting any better. You don't have too many options. You cannot move out of the city. You have to continue working here. You cannot necessarily find solutions in terms of installing air purifiers away. So at the end of the day, there is a certain helplessness and inertia that sets in, which is dangerous to a certain extent, right? And I think even makers of health apps are realizing this. So knowing your blood glucose on a second by second basis does not necessarily improve outcomes all the time, right? So I think it's important to sensitize people. It's important to know where we stand. But an information overload without any clear solution can often lead to people just getting inert and numb to the situation. And I think that's the problem. That's possibly why there isn't as much outrage as one would expect with the air quality, simply because people feel quite helpless with the current situation.
Subscribe to MidDay India. Get direct notifications on all our videos by clicking on the bell icon.